Dun, dun, dun. Good morning, everybody. 51 minutes after the hour. Federal food police now targeting daycare centers. Under new rules, the feds will weigh and measure all kids in daycare. The CDC claims nearly 13 million American children are obese. So is weighing them in daycare a good idea or way over the top? Here to debate, CEO of Concerned Women for America, Penny Nance, and Democratic strategist Basil Smikle Jr. Thanks for being with us.
Good to be here.
Basil, good idea, bad idea?
I think this is a great idea. Look, childhood obesity leads to adult obesity. It's a health burden on families. It's a budget burden on municipalities. And I think if you can start tracking these issues early, I think you can. I think you can stave it off. I think this is a great idea.
Penny, on the other hand, you say it actually ends up in a roundabout way being a budget burden on the family, right?
That's right. Well, I mean, the bottom line is we've got it backwards here. Heavy adults lead to heavy kids. And this is Michelle Obama's Hunger-Free Kids Act, which created 1 million more hungry kids because they stopped buying school lunch, and it's more government intrusion. I mean, who are the bureaucrats who are going to go into these daycare centers and weigh and measure kids and counsel them on weight? They're not known for their tact. And as a mom, that makes me very nervous. But the issue here is good daycare, right? If we're going to help parents choose good daycare providers who are going to, at the end of the day, feed our kids well, we need to help parents. Why don't we take some of the $11 billion that this program costs every year and actually refund it back to parents so parents can choose better daycare providers? Or, and when we ask parents the kind of child care they want, they usually say a parent or a grandparent, they want kin care.
Right.
They can perhaps afford that now.
Basil, it's not just good daycare, though. Doesn't it come from the parents, too, when they're teaching?
You know what? I absolutely agree with that point. I think this definitely starts at home, but there are other structural problems. You have a lot of communities across the country that are food deserts. In other words, they don't have a lot of healthy food options in those neighborhoods. But this is a policy that's not like this, let's say, taxing sugary drinks or smoking policies, which I think have a burden, undue burden on the private interests here. This is not sort of a nanny gate. This is a study. The parents can opt into it or opt out of it. So I think just having this data and tracking this data is ultimately very good for policymakers.
Right, that's the idea, is to get research. This is a statement from the USDA. They say the USDA had this to say: the study takes place in the, quote, context of heightened concern about adequate nutrition, diet quality, and obesity in young children. So is there anything wrong with just figuring out, you know, what we are working with and having some numbers to go on, Penny?
Look, stats are great, and it is important, and we want them in all sorts of areas. But let's be real here. We're cutting out the parents. This is the federal government intruding, going straight to the kids, when the real source of weight issues for children are the parents. Children don't eat one thing that is not purchased for them. So we've got to bring parents in. And whether you're an inner city mom or you're a suburban mom, you love your kids. Let's bring them into the issue, not push them aside.
And Basil, we've had students who, you know, young kids who have come forward and said, you know, I get embarrassed, you know, not just when I get tested on the mile run, but when I get weighed and when my body mass index is told to me and I have to bring home a report card for my body mass index to my family. Is there a way to go about this where, you know, whether it's daycare or older children, where it's not going to compromise the self-respect and self-esteem of these children?
You know, that's absolutely important. And I think when you add that to a lot of school districts, for example, that take money out of physical education programs, this becomes a much bigger problem, and it places a significant burden on the parent. I agree with Penny. This definitely starts at home, and you can find ways to have parents counsel their children about these healthy food options. But yeah, I do think, you know, embarrassment's a huge part of it. We need to take that out of the process and give these families some dignity. But I definitely think that having that information, arming parents with great information about their options, I think is the start.
Yeah, and crossing our fingers that they'll pass that information along to their kids so everybody we can have a healthy America. Penny and Basil, thank you so much.
Thank you.
We all want to get to the same place. We just got to figure out where we're going, how we're going to get there.